today we are dealing with an interesting topic, that is a Counauds. Counauds liver segments. So we'll be drawing the diagram and we'll be looking at the liver segments. So to begin with, we'll be drawing the how the liver looks. So this is the liver, and how is the demarcation? So what you see on the left will be the right posterior section, and now what I'm going to draw will be the right anterior section. Then we have the left part. This is all the right part. The left part is a smaller portion, so it includes the left medial portion and the left lateral portion. So to make it simple, this is, as you know, it's on the left, so it is a left portion, and this is on the right. So we will just divide it by numbers and then we'll discuss the actual position. So this is 7, this is 6, 8, this is 5, and this is 4, this is 2 and 3. So what is the easier way is that it goes from 2. So it starts here 2, 3, 4, and then comes 5, 6, 7, 8. Yeah, it forms a circle. So 5, 6, 7, 8, and there's 2, 3, 4. So what about the position? So we know that this is left and this is right. And the posterior, this is nothing but the posterior part. And here it is nothing but the anterior part. So the anterior and the posterior of the right part of the liver. And now when we move on to the left part, the left part, it includes the left medial section and the left lateral section. So here there is a left medial and the left lateral. So if you see the extreme, it is a LL, that is the left lateral, and here it is the posterior, so the right posterior. So there is no confusion. So just to put it in the name's perspective, 2 and 3 belong to the left lateral. Next, the 4 belongs to the left medial. The 5 and 8 and 5, it belongs to the right anterior, and 7 and 6 belongs to the right posterior. So this is about the Counauds liver segments. So other important thing to do is we need to know some important landmarks of this. So the landmarks will be, there is the line that differentiates between the 2, 3 and 4 is nothing but there is something known as the umbilical. There's the umbilical fissure. So what is this umbilical fissure? Umbilical fissure is nothing but the falciform. It is nothing but the falciform ligament. Then we look at the partition between the 4 and 5 and 8. So 4, 5 and 8, here the division, it refers to the, there is the Cantley sign. The Cantley sign. Then looking at the partition between the 5 and 8 and 6 and 7. So this partition, it refers to the right portal fissure. It refers to the right portal fissure. So this was about the coinoid liver segments. Now we are going to have a flip of this liver. So when we flip the liver, what do we see? So this is how the liver looks from back. So here again we just do the partition. This will be 2 and 3. So it's always important to write it as well as soon as we draw a structure so that we don't forget it for labeling. So this will be 1, this will be 8, this will be 7, this will be 6, this will be 5, this will be 4, this will be 1. So this is how it looks. So now we are just going to divide it. So since it's in our perspective, the right side is the right side and the left side is the left. So this is R and this is L. So just to put our perspective, this is the right posterior. This is the RP, right posterior, and this is nothing but the right anterior. And looking at the left part, This is the left lateral, and this is nothing but the left medial. So the portion which divides the 2 and 3 and the 4, 2, 3 and 4, so this is nothing but the umbilical ligament. So this is nothing but the umbilical ligament. And what does this relate to? So this is nothing but the falciform umbilical fissure. This is umbilical fissure, and this is nothing but the falciform ligament. So what does this do? This is basically between the 2 and 3 and 4. Then we also look at the Cantley sign. So the Cantley sign is present between the 4 and 5. Cantley sign. So just to know what is the right lobe and left lobe, the left lobe, it basically includes up to 2 and 3. This is the left lobe. And right lobe is here. This is from 4 to the 4, 5, 6, everything. Majority comes here to the right lobe. So here we didn't ask any question because it is a image based question.